Welcome to Health Tech Heroes, where we talk to innovators who are rewriting the DNA of healthcare. Today, we are joined by Adam Williams, Vice President of Payer Operations and Strategy at Tava Health. Adam is a trailblazer in the healthcare industry dedicated to bridging gaps between payers and providers, enhancing access to mental health services and driving sustainable value-based care. With over a decade of experience in leadership roles across payer strategy, operations, and population health, Adam is at the forefront of changing how we think about healthcare partnerships and outcomes. We can't wait to hear his story and insights. Welcome to Health Tech Heroes, Adam.
Thank you so much for having me. I appreciate it.
And thank you very much for taking time to be with us. Can you share the journey that led you to a career in healthcare? Were there any personal or defining moments that shaped your passion for improving access to care?
As I kind of think about my journey within our healthcare system, I go back to when I was a child. And so when I was a kid, my father, unfortunately, was pretty sick. And so he suffered from Crohn's disease. And by the time that I was 13 years old, he ended up having to have a small intestine transplant. And before that, he had 37 operations on his small intestine, large intestine, as well as part of his stomach, and was at a point in his life where he had been on intravenous food for about 2 years. And I remember the day when I got home and my dad shared with me what I perceived to be at the time, his death letter. And it ultimately said, if you don't have a transplant, we estimate that you have as much as 6 months left to live, unfortunately. And having 5 kids, my dad made the decision to go ahead and get the transplant. And with that transplant at the time, it was not covered by Medicare or Medicaid services. And so no commercial payer within the US also covered it. And so it was deemed an experimental procedure, and my parents were fully responsible for the cost of care. And so unfortunately, they ended up going into medical bankruptcy at the time. And, there was times that we were in and out of different homes and really struggled financially. And so what ultimately pushed me to a career within healthcare and in particular healthcare administration was to change that path, right? It is my belief that within the richest country in the world, we should not have citizens having to financially struggle just to have a procedure or to get the care that they need. We should not be putting, our population through those difficulties. And so we have to find ways of improving the system to make it easier to access the care and ultimately be able to get better without having to take the burden on of all this financial strife that, my family had to go through.
And I have to 100% agree with every point that you made. And I'm sorry to hear that you had to witness and your young family had to go through so much. And a part of the introduction, and when I look at your profile, you do focus a little bit more on the mental health. What is that component of mental health that attracts your passion?
Yeah, so beyond my father, I also have had other family members that have really struggled with mental health in particular. I've had family members who suffered from bipolar disorder, as well as major depression and a lot of anxiety, and have seen the difficulties again of just getting into care with mental health, and have had family members unfortunately attempt suicide, and a lot of it came from just not having the right support, and again not being able to access the care that they needed in the way in which they needed it. And so my goal is to try and make it easier for people to be able to get to the care that they need and meet them wherever they want to be met.
Yeah, I mean, mental health there's a lot of awareness now than even few years ago, and I hope this trend continues and hopefully people get access and the help we need. I mean, like all of us, not just as people as a third person, but all of us get the help we need. Reflecting on your diverse career from early roles in physical therapy to leadership position in population health, how has your perspective on healthcare transformation evolved? And more specifically, why do you focus on the payer landscape so much? And and is that the biggest scope that we have to help patients?
Yeah, I think that, for me, there's an opportunity to continue to think about how we innovate with regards to coverage for that care, right? And so Here in the US, we've been using for the longest time a fee for service model of care. And that's great if you really want to focus a volume based care system. It's not so great when you're trying to focus on improving access necessarily or improving outcomes for whether it be physical therapy and musculoskeletal conditions or improving, the overall state of a client with depression, right? And so as we think about how we try to shift the system, it has to come from a lens that's not predicated upon purely volume, but also considering, improving access and ultimately quality of care that we're providing to our citizens.
Uh, just for my understanding, when you do increase the volume that you are providing effectively for number of patients, does that not uh, improve access to number of patients, or these are two different concepts? Can you separate those two concepts out a little bit more clearly for me and the audience?
Yeah, absolutely. I think from an access perspective, when you think about just getting in the door, right? It could be either a physical or virtual door now for mental health services in particular, right? And just because there is this a company who offers these services, the way that we kind of look at it at Tava is we want to be able to be able to see anyone with any insurance, right, in time. And so if we really want to create access to do so, you have to be in network with that payer, right? And going back to just maintaining continuity of care that we have, we want to be able to see a client through their whole care continuum, whether that be from an EAP to then transition to an insurance sponsored sessions. And that way we can see them over, their lifetime of care for mental health services. And so that way we're really building that continuity. I think from an access perspective for um, population, it definitely is a little different and it depends on the service too, right? Some services, we're not necessarily just trying to get a bunch of volume in. With mental health, we do want to get access, which is number one. And then ultimately you are trying to see someone for multiple sessions in order to make sure that over either their current depressive episode or over their lifetime continuum of mental health illness, that there is someone there to support them. Whereas with physical health, it may be different, right? You don't necessarily need to have, 200 physical therapy sessions on sprained ankle, as an example, right? And so we have to be thoughtful about this volume that we're trying to gain and where it makes sense to really increase that access and volume versus where, there could be alternatives to potentially look at to support what a client may need.
Can you share some of the key offerings that set Tava apart in the space? Effectively, what exactly Tava does? What is that unique offering that Tava has for the patients and for the system?
Yeah, so I think for trying to drive payer partnerships, our initial goal that we sort of set out to have within our payer partnerships team at Tava was to try and get 65% commercial coverage in all 50 states throughout the US. And as we look at it recently, we have seen as we've kind of looked at all of the different payers and where we have contracts currently, we have 75 plus contracts with various commercial carriers throughout the US, a lot of TPAs as well as rental networks too through those agreements. And with that, we've been able to build out the most comprehensive commercial coverage within our space. And so we believe that ultimately will be a good driver to make it so that any individual who has a commercial insurance should be able to sign up with Tava and not have as much strife of dealing with out of network claims, right? The barrier there is all of a sudden a client may end up having to pay more for services than they expected because we were potentially out of network with the care. And so that's one of the key drivers that we had there. I think the big difference from us to others within this space really comes down to our technology. And ultimately, as we think about what we're trying to provide, not just for clients, but ultimately providers as well, is the ability to really be their full stack platform. If I'm a therapist and I'm looking to get into private practice, it really takes often 12 plus point solutions, meaning credit card vendors and video solutions, right? Marketing and billing and credentialing. And if we could be that full stack platform for a provider, we believe that with that solution, we could then have them bring us clients too, right? They're going to have clients that are associated with them that they want to bring over. And so we could help support each other both in that way.
Terrific. I know you're passionate about Tava. What are the standout success stories where these partnerships have improved mental health outcomes for communities or organizations? And what is that story that you share with everybody? Asks like, hey, what do you do, Adam? What are you proud of in this space?
Yeah, I think right now it really is the access that we give people, for the longest time. And I still think that for a lot of individuals, they don't know where to turn for services for mental health. And that is something that we've really leaned in on. And to be able to provide that access to anyone, again, who has commercial insurance, for us and kind of where we're going to take it is we would love to also expand to add governmental programs in the future, whether that be Medicaid, Medicare, and eventually, TRICARE as well, and be able to see, our military lives and stuff and like that, and to be able to support them too. And so I think within both of those, there's great opportunities. In regards to great standout stories, I think that for us, one of the key successes is our ability to, maintain and retain a lot of the employers that partner with us for sponsored sessions. Our retention rate is incredibly high with the employers that have chosen to partner with us. And so, as we look at that, that is a key differentiator for us. And then, as we continue to think about ways in which that we could partner, deeper with payers is, building on some of our technology and solutions for them.
So when you said that employers come and you said there is a high retention rate when employees decide to partner with you. And what are those factors that make them stay? And what is the real benefit that they see staying with Tava? Can you double click on that from the employer's perspective? Can you help me out there?
Yeah, I think that, within what we can provide to an employer would be, as employees are able to seek care for their mental health journey, it ultimately helps to do things like ensure their employees are showing up and they're present when they're at work, right? They're not focused about their anxiety or their depression, and they have the care that they need and feel supported by their employer, with these sponsored sessions that the employer may provide. Or, we're able to continue that care by having sponsored sessions. And then once those sponsored sessions have lapsed, they can continue to see their TAVA provider because their provider is in network with their insurance. And so from a continuum perspective, we could stay with that client throughout the year, and they're not having to go try and find another provider who may be in network with their insurance. They could just stay with their same provider and get that same kind of care.
So effectively, the employers are seeing a positive trend within their workplaces. And how do they tend to measure that? Is it something that it's so evident that you don't really have to have a metric for it? Or what is the metric they're looking at? It's like efficiency or just overall pleasantness at work? What is that they're looking for and they're
Yeah,
achieving?
I think there's a couple of things. I think first and foremost, it's, absenteeism, right?
Okay.
If my employee is taking a sick day and they're not there to perform the tasks that we're paying them for because they are either physically or mentally not there, right? That creates barriers, right, for an employer. And then in addition to that, there's retention too. So employees that feel like they're getting a great benefit from, us as a service to them, we're able to then show to that employer, like, hey, by having Tava, your employees are happier. And because your employees are happier, they're wanting to stay with you as an employer. And so that creates a lot of successes for us as we continue to work with various employers throughout the US.
How navigating payer strategies and operations can be complex. What challenges have you faced in scaling Tava's impact? How have you overcome there? You're remarkably at 75% on the commercial side, and you'll eventually want to go into Medicare and on the government side as well. But I'm sure you have had challenges. And what are your current challenges? What are your future challenges that you see?
Yeah, I think in regards to current challenges, it's sort of getting that last kind of, 10 to 15% of payers that we haven't, partnered with yet to um, want to partner with us. I think that, one of the things that we at least on my team, that we really strive for is, there's not really a no per se with a payer, right? They may tell you initially no, that they can't contract, but to me, I'm a strong believer that, again, as long as their feet are still in the room, you have a chance, right? And so,
Yes.
if they're still there and they're listening to you, there's something that pique their interest with. And so how can you dive deeper in that with them, and really, really find that tangible thing that you can connect on, that ultimately will lead to a yes, and their desire to want to partner with you. I think a lot of times, a challenge that we get is there's a concern from, some of the payers that, we're going to ask too much from a rate perspective. And I think there has to be a balance there, right? We're realistic in how we perceive our negotiations from a fee schedule perspective with a payer, in that, if I ask for $200 for every session, I recognize that if that's a client who goes to sign up and has a $200 session every time, and they have a high deductible health plan, that can be very expensive, right? If they see their provider 4 times in a month, that's $800 out of pocket. So I don't want that to happen, right? And so we have to find a balance between the client's needs, as well as trying to ensure that our providers get compensated in a way that's fair and reasonable for them too. And so there's always these different pushes and pulls that we have to kind of to tug at, and find balance between. And I think that's both a challenge as well as a great opportunity that we have.
Like, how do you solve that if there is a patient who has got a high deductible and your goal is to make it accessible and they have like, thousands of dollar deductible? By the time they even get covered, it's like 6 months in the year, right? How do you work around it? Like, what are the options available?
Yeah. So, but, with some of the changes that have come with some recent laws, again, where they're allowing the $0 first dollar kind of pass with high deductible health plans for virtual sessions, that is a great opportunity for us to lean into that. And so as that becomes law again, and shifts how we think about these telehealth services, if we continue to make telehealth and virtual health lower cost, as well as more accessible to the client in not having a cost share to them, whether that be copay, co-insurance, or deductible, there lies a great opportunity to support anyone who's trying to sign up. The challenge on that, the flip side, is a lot of that only comes if employers are willing to make those changes themselves. And so a lot of this is education back to employers on how they could do this, how they could support their employees better with how they set up their benefits designs, and working with their brokers on those kind of things. And so that's areas where our sales and marketing team are kind of leaning in on now. And so with all of that, we start to evolve and change how we think about coverage for the cost of care.
All right. Terrific. There is not just the business aspect of it, there is a policy aspect of it, there is innovative ideas. So all these variables come together to bring a solution, and eventually, hopefully, that patient who cannot access now does have access to it. As someone who has worked, and it kind of beautifully brings us to the next question, as someone who works at the intersection of policy, business, and innovation, what trends do you foresee shaping the future of mental health services and value-based care? Say in 1 year, 2 years, 5 years might be too long, but you can give it a shot. But like in next couple of years, what are the trends? Where do you think it's going?
Yeah, I think there's definitely a push. I think a desire from provider groups, as well as a push on the payer side, to figuring out value-based care within the mental health system, right? We've done a pretty good job of setting up value-based care on the primary care side of the world, right? There's shared savings opportunities, there's care coordination fees, there's risk between the primary care provider and an insurance company, and then obviously full risk or capitation that a provider could take, really in a primary care setting, which is most optimal because you can really control the cost of care as a primary care provider. Mental health has kind of lagged in this, in not just partnering in a value-based arrangement with payers, but also helping to define what does a value-based arrangement look like. Is it reducing admissions to hospitals because patients are seeing a therapist, instead of going to the ER for their depression or anxiety because they don't know where else to turn to? Is it objective measures, right? Things such as a PHQ-9 or a GAD-7 score for anxiety and depression, respectively, right? And so how do we tie all those things in? And then what's the best path forward? One of the things that I've been really thinking about is how do we take, a model of care where they've kind of done this in musculoskeletal recently, and where we take almost like a case rate or a bundle payment type situation where, if I could say to a payer, hey, instead of paying us for fee for service, right, this volume stuff, what if we just say, hey, for depression, we'll come up with a case rate for coverage of depression for these clients, and they get 10 sessions for their depression. And yes, that's an arbitrary number, and I'm not saying that clinically is what's needed, but start to think about how can we have these conversations and frank conversations that, a fee for service world isn't the best probably for mental health, and how do we look at alternative payment models to start to shift how we get paid and what we get compensated for, I think is where we're going.
All right, and compensation fairly that is affordable. It is a good payment for the physician or for the therapist, and it is effective for the and affordable for the patient too. So it is a complex area that you're working with. And how do you envision technology playing a larger role in bridging gaps in mental health accessibility? Are there any specific opportunities that you'd like to explore further?
Absolutely. One of the things that we're starting to do and realize as we talk to payers further is, their own teams struggle to help place members sometimes for mental health sessions. And so one of the new things that we've built here at Tava is a care navigation solution where we could equip a care navigation team at a payer that we have a contract with, and we could give them the ability to schedule those clients. And that's a huge unlock because now that client isn't worrying about having to find care themselves. And we've solved the need for that case manager because they're trying to help these members get placed and they struggle. And, honestly, today, no one answers a phone anymore, right? And so if they could just schedule for them, it makes it a lot easier to really solve that access need. And so as we lean into that further, that's one of the big things that I think we're really excited about. I also am excited for how AI can continue to disrupt us, within the mental health space as well as the physical health space, but more from an adjunct perspective, right? Still a strong believer that ultimately humans heal humans. And so I think when using AI, we have to do it thoughtfully and in a way in which it's an adjunct to the services we're providing. And whether that's to enhance things such as our RCM experience, or if it's to enhance our credentialing and enrollment experience for our providers, something to support operationally, that is where I think we can really lean in to AI and LLMs as well, and all of these kind of new technologies that we could really build out and really transcend what we're trying to do here in the healthcare system.
And the goal would be for that is to increase the human to human interaction. The time that you spend with human to human interaction is optimal and as maximized as possible because all the operationally, the adjunct aspects of the healthcare is taken care of using AI. And how deep are we with AI in Tava? Are we actively things, which I'm going to presume you are, but any insight into that?
Yeah, absolutely. We are using AI, and we use it more from an operational perspective. Again, if there's areas where we can create efficiencies from an operations perspective, that's where we feel like we can lean in. Again, we don't want to use it to, replace people, right? Or replace the therapist. That's not something we want to do. Again, there are things that we could do to really improve operationally how we do things. And I'll talk about our credentialing and enrollment team for a second here, where we've really leaned in quite a bit there for not just AI, but also building efficiencies for them where their whole role is shifted from being data entry team members to being data integrity team members, where instead of having to touch it and type it and spend an hour just crunching this data, they can now hit a button, it runs for 5 minutes, and now they could see where the data is, and they're reviewing it. And so it shifts what their role is and how they interact.
All right. Yeah, that saves a lot of time. Instead of being data entry, data integrity, it cuts down time by perhaps 70%, 80% of the time they spend on data entry. Times uh, there is always an argument that, hey, it's easier for me to just enter the correct data than correct the wrong data. But in your experience, you have seen that being a data integrity perspective is better than the data entry. I think eventually AI will just get so much better that the time you spend on checking the data will be very minimal. We are still at a very nascent
Absolutely.
stage. Yeah. All right. That brings us to your thought leadership. You have been a leader and your activities are very entrepreneurial. So would love to hear your advice. Your leadership has spanned provider groups, payer relations, and tech-enabled healthcare. What advice would you give to emerging entrepreneurs who want to innovate in health tech space?
I think it's a great time to really start to innovate, especially as we continue to lean in on new technologies to better support us from a connectivity perspective. Even there is a wonderful opportunity now for entrepreneurs to lean in. Now, with that being said, I always kind of caution those who want to go into health tech that is going to be more challenging than you may think, especially with all of our policies and the intersections that you have with payers. Every payer is different, everyone interprets rules differently. So, a lot of it is really being flexible. I think ultimately you have to be flexible with your interactions with people, and that will ultimately help to drive your success. Um, if you're dead focused that your idea is the right idea and that's it, it's going to be tough. And I would always say, be open and do less talking. In all honesty, do more listening. My team member Matt and I have a slide in our presentations that we do with payers the first time we meet with them, and it's purely a listening slide, right? I can go to a payer and I can pitch Tava and I could talk about how great Tava is, but if I'm not keying in on or listening to what that payer may feel their difficulties are within the mental health space, how am I going to know that the solution that we're going to provide actually is something that helps them? And I truly believe that it needs to be a win-win. Whatever you're doing, you need to find a win-win, and then that ultimately will create, trust, and then you're off to the races from there.
Okay, so this was very interesting, and I think can you explain what does that listening slide look like? Is it just an empty slide, or have you written that hey, we are here to listen? What does it like literally look like?
Yeah, so it has 5 questions. And, the first one being, what is the payer currently working on within the mental health space? What are their pain points within the mental and behavioral health space? What are things that they feel should be solved that have not been solved by current groups? How do they believe that we can help to solve some of those problems? And then ultimately, what if they had a perfect system, how would they build it? And what would they do differently? And then how could we help to be an adjunct to what they want to do as a payer?
That's golden. Thank you very much for that. Yeah, that was awesome. All right, the listening slide. All right, leading diverse teams and fostering collaboration is essentially in your role, right? Is essentially in your role. What leadership principles or practices have been most impactful in your own journey?
Yeah, I really key in on being empathetic leader, in that I, again, kind of going back to humans heal humans, right? We all come from different walks of life, and you never really know what someone is dealing with until you ask them, how are you doing? And that has been a huge unlock for me as a leader. So I've built trust with people by genuinely caring about who they are and how they got to where they got to. And if I can help support them, just by listening myself and being a thoughtful listener, I think that that ultimately helps build that trust. And with that, you're going to be able to have really high functional teams. You know, I I also spend a good amount of time within our interview process for new candidates for new roles, just trying to get to know them as a person. And I think that by the time that we're involved from a project interview, or we've gotten to the project interview phase stage, they have the skills, but what are those tangible things that you know they want to lean in on? How do they come across? When you ask them, Give me an example of a time in which you failed, and what did you learn from that failure, right? So often we try to key in on our successes, but I know for myself the only time I ever learn is when I fail. And so I think that that's a key for any of us.
What will be your advice, and how do you think we will reach that perfect world? What do we need to do now so that we reach that perfect world? What would be your advice?
I think honestly, just be more caring. We don't spend enough time getting to know each other, whether that be in person or virtually or however we connect with people. We don't do so in a caring manner. I think if people truly uh, cared more, not just in meetings, also, showed their neighbors that they cared, right? Like this person that lives next door to you, they could live next door to you for 25 years, but if you don't break bread with them, if you don't get to know them, if you don't invite them in and let them know who you are, you're never going to really, build friendships. You're not going to build, the life that I think a lot of us strive for. I think so often we assume that people who have, more money are just happier. Often that's not the case, right? That there are some of the people who struggle the most, and we need to find a way to really get to know each other and be supportive of each other. And again, if we do that from a caring lens, I think that we would all be happier in society.
Yeah. And I think there is a factor as we go more into technology, and and the technology is pushing us to be a little bit more isolated. Caring and having focus on care will be very important. And thank you very much for that. Before we wrap up, Adam, you will have 90 seconds to share anything we missed or reiterate anything that you deem very important. It does not have to be 90 seconds. If you want to take 4 minutes, you're more than welcome to. Question is yours. The answer is yours. The stage is yours.
Yeah, I think the thing that I would key in on as we look to wrap up is, listen first. We're so quick in society to speak before, and I think if we did a better job of just listening, it would give us the ability to know how we can support someone, right? I think the best salespeople are the salespeople that can listen. And if you listen and you know what your customer, what your teammate, what your friend wants, you're going to be able to be successful. And so we need to do more listening and less talking.
Thank you very much, Adam. It has been a fascinating session, and there is so much to learn in this space, but we get a flavor how complex it is. And I'm glad that you are working on it. Tava is working on it. With that, again, thank you very much, Adam.
Thank you so much. I appreciate it.